You'll see if you look at all your athletes, probably a lot of them stand with what we call a lower cross syndrome type of posture. What that means is that their hips have pitched forward in the front, so their pelvis is dipping forward in the front, and to compensate for that, they are hyperextending their back, basically walking around all day in this kind of posture. You might hear from them complaints of lower back pain. They're going to be at higher odds of hip flexor pulls, of groin pulls, because basically everything is out of whack. We need to get their pelvis from here to a more neutral position, and subsequently that will allow their back to go to a more neutral position as well. One area of tension that can really lead to that type of posture predisposition is hip flexor tension. So you've got a lot of muscles that are called hip flexors. One such muscle is your rectus femoris. It's one of your quadriceps, so one of your quads, goes all the way from below the knee joint all the way to the front of the hip. And again, if it's tight, it's going to pull your pelvis down and cause you to hyperextend your back. So one quick fix for that is something that kind of industry-wide is known as the couch stretch. So what we can do, we can use a wall, or the name, couch stretch infers that there might be a couch. So at home, an athlete could use a couch. It might be a little bit more comfortable for this stretch. But what we'll do is go against the wall and place your shin against the wall while being in this half kneeling position. Now, a lot of athletes might not be able to comfortably just plop down into that position. So one thing you could try is just getting on hands and knees, placing the leg up against the wall, bringing the other leg out in front, and then trying to come upright from there. Now, you'll see very quickly that a lot of athletes will try to resort to where they know to move from. So they might get to here, and then they might hyperextend their back to get the rest of the way. But that's taking the emphasis off the tissues that we want to stretch and just further ingraining the problem. So what we can do to fix that, we'll have the athlete locate their ASIS. It's a little bony landmark on the front of the pelvis. And what they're going to do is take this bone and actively try to tuck that bone in. So another cue that I might use with some of my patients or some of my clients is tell them, picture what position a dog's tail might go into when the dog gets yelled at. So if you can think of that tail tucking position, we're going to get that tail tucked. We're going to get the rib cage tucked in as well. So we're trying to get that ASIS and the bottom of the rib cage together. And then once we've achieved that position, we're going to hold those tight as we try to move the hips or the butt away from the heel. And that's a great way to get an awesome stretch through the hip flexors.